Bartender, shot.
Make that too.
No problem.
Where'd you get that scar on your arm?
Back in the war. Now.
Enjoy your drinks.
What are you drinking for?
I'm drinking to forget. How about you?
Me too. I gotta go.
See ya. You didn't deserve to die like this.
One of the most common ways of dealing with the painful feelings of PTSD is to increase use of alcohol and illicit drugs, or the use of prescription drugs in a way that is not prescribed for that individual. It is understandable that a person experiencing symptoms of PTSD would try these approaches in order to feel better temporarily, as a way of self-medicating. And while these approaches seem to help in the very short term, over the long term they actually cause problems of their own. PTSD can lead to substance abuse problems in people who never struggled with drugs or alcohol, or can worsen problems that already existed. It is estimated that 30 to 60% of people seeking treatment for substance abuse problems also have PTSD.
There are lots of people with bipolar disorder who self-medicate. They use marijuana or alcohol or other substances, and maybe not even in excess to deal with, but they use them to deal with the symptoms. A good thing or a bad thing?
Oh, definitely a bad thing, though I can understand it. I drank, before my diagnosis, I drank every night sometimes. I was miserable, and even when the alcohol, which is depressant, made me cry, I would drink some more. And so it's very normal. Up to 40% of people with bipolar disorder have a dual diagnosis. Now that means a drug and alcohol problem. But many of us with the illness, especially if we're newly diagnosed, say, oh, that pot, it calms me down. It helps with my medication side effects. It takes the edge off of the mania. People will use alcohol for the same reason. I can't sleep at night. I'm just going to have some whiskey. I'm going to take care of it this way. The problem is, and it's a big one, alcohol and pot do not even come close to helping the symptoms of bipolar disorder. They exacerbate them mainly because they disrupt sleep. And sleep is the most important tool you have outside of medications for regulating your moods because of your circadian rhythm and the way your body works. If you stay up all night drinking and smoking pot, you are going to be sick the next day. So if you're smoking pot or using alcohol to treat bipolar disorder, you're doing a disservice to yourself because it's going to make the illness worse. I understand the desire with all of my heart, but that's one thing if you can get help for, is deal with the fact that drugs and alcohol are not making you better. If you want to continue to smoke and drink, at least know that what you're doing is harming your illness. It's definitely harming your body. But if you want to get better, then you have to stop drugs and alcohol so that you can sleep normally and you can get the illness treated correctly and you're not interfering with your medications.
Cole, I love you. You're my best friend.
Colleen, there's something I need to tell you.
Yeah!
I slept with your boyfriend.
What? Oh! Oh! Oh!
Right at those pillars and then you like the church is the bar.
Why?
Sir, I think he's dead. Somebody call 911.